In today's patient care example, I wanted to go over the difference between a piriformis stretch and a hip capsule stretch. So I had a patient today who benefits from both, and I will describe why I know this. Her symptoms were a lot of pelvic pain that kind of went into her sit bone, as well as some pain in her hip with sleeping. And so in assessing her range of motion at her hip, she is limited in both external rotation and external rotation with adduction, so adduction. So what we think typically stretches a piriformis stretch is the typical, pigeon pose or the cross the leg over figure 4. And that is an emphasis on external rotation. So external rotation is where your knee goes wider than your foot. But a lot of them, the knee actually comes out to the side, and that is hip abduction, abduction. That actually doesn't get to the piriformis. So these stretches can stretch some of our bigger glute muscles and the joint capsule of the hip in external rotation and flexion, but it doesn't get to the tiny muscle of the piriformis. So when people have true piriformis problems, what they'll have is a restriction of when that knee starts to come across their body. So it needs to be external rotation and a deduction, or coming more toward the midline. And so for this individual, when I was checking her range of motion, she was limited in the external rotation with the knee out to the side, as well as limited side to side with her ability for that leg to kind of come across the midline. So I needed to give her both of these stretches. So for the stretch that targets the piriformis, you're going to come to ideally a corner. Your leg next to the wall is going to be straight, and your other foot is going to cross over you to the other side of the corner. And then you're going to slide your foot as far as you can across your body and push your knee away. So this is getting hip external rotation with adduction, which is where your leg's going across your body, and it is targeting the piriformis. As you gain more length in this muscle, you can scoot your body down further. That will kind of pull you into more flexion and external rotation. This stretch is what we typically think of when we think of a piriformis stretch, or some version of it like pigeon pose. So this is where you've got your foot on your other knee going into external rotation, your knees coming out to the side, and you're gonna hug your leg up to you as far as you can, or if you can't, just keep that foot on the ground. This targets some of your bigger glute muscles, but more than anything, your hip capsule. A lot of people need this stretch as well, but it really doesn't target the piriformis. So when the piriformis is part of the problem or part of kind of the cause of pain or restricted range of motion, this stretch will not get it. So if you're having hip pain or pelvic pain or what is deemed piriformis syndrome, I would kind of check and see which of these stretches feels tighter, most limited, or if you need both of them.